My name is Eric Decker.
Recording in progress.
I'm at the Department of Food Science at the University of Massachusetts. I'm also a Food Forum member and the chair of the planning committee for this workshop. On behalf of the Food Forum of the National Academy of Sciences, Engineering, Medicine, I would like to welcome you to our virtual workshop today. If you're joining us for the first time, this workshop is hosted by the Food Forum, a convening activity of the National Academy. For more information about the Food Forum, please visit our website. And you can also find the agenda and bio sketches of all speakers, moderators, and the planning committee on the Food Forum webpage. If you missed the session yesterday, this workshop is being recorded and the presentations and videos will be posted on this webpage in about 1 to 2 weeks. So we'll continue with session 2, and I have the pleasure of welcoming back the moderator of yesterday's session, Cindy Davis, and Cindy's going to give us a brief summary of what was talked about yesterday. Thank you.
Is that showing up appropriately?
Yes.
Great. Well, hi, everyone. My name is Cindy Davis, and I'm a National Program Leader for Human Nutrition in USDA ARS. And it's a pleasure to be able to give you an overview of the first session that happened yesterday on the opportunities for precision and personalized nutrition. Session 1 really focused on setting the stage in terms of, and I can't see my whole slides with this way, so really set on setting the stage. And the focus was on what is the current evidence base of precision nutrition and identifying gaps in knowledge. The first speaker was John Mathers, who spoke on really kind of set the overview on terms of human variability, a basis for precision and personalized nutrition. He highlighted that we are all different in many ways, that genetic factors can explain some of those inter-individual differences, and some of the differences that he talked about included things such as eye color, body shape, and how fast we grow and how rapidly we age. Other relevant biological factors include the epigenome and microbiome, and later presentations brought up the idea of a behaviorome and an immunohome. Psychological and sociological factors are likely to be critical in implementing effective precision and personalized nutrition strategies that improve public health. And that future developments of precision and personalized nutrition should include greater focus on individual aspirations, barriers, and facilitators, and should address inequities. The next speaker was Constance Hillard from the University of North Texas, and she talked about precision nutrition at the interface of history and genomics. She highlighted that both precision medicine and precision nutrition only work when they are precise, that African Americans have a 75% rate of hypertension and a 3-fold higher mortality rate from kidney failure than other demographic groups, and that Black Americans of slave descent did not come from the West African coast, but rather from the sodium-deficient deep interior. They were genetically adapted to 200 milligrams of sodium per day, but in the United States today, they consume about 3,400 milligrams of sodium per day. And that America's one-size-fits-all nutritional standards represent a 1,700% greater sodium intake for the 37 million African Americans of slave descent than what their ancestors consumed. She concluded by saying that America is not just multi-ethnic or multiracial, but it is also multi-genomic. Modern genomics and the testing of DNA ancestry has given American society the opportunity to bring greater precision to the sodium needs of all Americans. The nutritional community will, for the first time, have the necessary scientific data to consider stratifying sodium guidelines by DNA ancestry. And it's something that we should be thinking about when we're thinking about requirements for many different nutrients. Our next speaker was Abigail Johnson, and she spoke about integrating microbiome and dietary factors. She is from the University of Minnesota. She highlighted that foods and dietary patterns help to shape the microbiome, that diet-microbiome relationships are personal, and that multidimensional dietary data can be another ohm to be integrated with multi-omics data. And in fact, dietary analysis can be enhanced using computational tools from the microbiome space. And in fact, that it might provide some of the tools to understand the black matter. And one of the thoughts for the future is whether we can do metabarcoding for plants to better understand dietary intake. The next speaker was Christian Matelo from the Salk Institute. And he talked about opportunities and obstacles in precision nutrition from an engineering perspective. His talk highlighted that stable isotope tracing is an invaluable tool for probing the metabolism of biological systems and understanding disease. Dysregulated amino acid and sphingolipid metabolism can drive peripheral neuropathy and macular disease. MACTEL is a familial macular disease characterized by dysregulated amino acid metabolism, including low serine and glycine. Diabetes also rewires hepatic metabolism to impact serine, glycine, and neuropathy. And he really concluded, in the take-home message, was that quantifying metabolic dynamics can be more informative than static metabolomics, that the metabolites change over time and we really need to understand them dynamically. Our next speaker was Susan Carnell from Johns Hopkins University, and she talked about psychosocial influences on eating behavior. She highlighted that appetitive characteristics show a genetic influence and influence weight in children and adults. And an important gap is the need to understand more about development through the life course. She also said that appetitive characteristics may influence the effect of the food environment factors or interventions on diet and weight. And another gap is the need to consider individual differences in population and intervention research. Considering an individual's appetitive as well as physiological characteristics may help increase the impact of personalized nutrition. And there's a need to directly assess the effect of such combined interventions. Our last speaker was Michael Snyder from Stanford University, who talked about the integration of multiple omics. He highlighted that health is a product of both the genome and the exposome, and that we need to consider both of these in research. That multivariate longitudinal testing can lead to early detection of disease, and that wearable sensors are worn by 20% of US population, and these are valuable research tools because they make hundreds of thousands of measurements each day. In fact, wearable sensors can detect COVID-19 and other infectious diseases prior to symptoms via elevated heart rate. In addition, wearable sensors such as smartwatches enable personalized predictions of clinical laboratory messages. One of the final take-home thoughts that came out in a number of the presentations is that we need to think about a systems approach such as the biopsychosocial model, where we really look at the integration of biological factors, psychological factors, and social factors. And all three of these domains are important when we think about personalized nutrition. So the next question is, what are some of the new innovative methodologies and technologies? And this will be the focus of the next session. And I'd like to turn it over to Bruce Lee, who will be chairing this session.